So, very good evening, everyone, and thank you for joining today's workshop. And today we'll be talking about a lot on gut health. If you, every individual, I would say, has been struggling with some kind of gut issue or the other. It can be bloating, it can be indigestion, it can be, just burping, belching, or it can be just acidity, which, they have been struggling for years and probably thought that, it's not significant. But over a period of time, all these small gut symptoms become big and then start contributing to chronic conditions, and these can be eczema, it can be autoimmune condition, immune dysregulation, thyroid disorders, etc., etc. The list can be very long. So in today's workshop we will talk about what are the various kind of gut health symptoms an individual can be struggling with, and what is contributing to those symptoms, what are the internal reasons for that, and then how can we address that and kind of prevent a lot of a bigger diagnosis which can eventually come later over the years. So with that we will get started. I invite Dr. Ashwani Garg to lead this workshop. Towards the end we will have an opportunity for a live Q&A, so you can leave your questions in the chat and we will also take those questions in the live Q&A as well. So over to you, Dr. Ashwani.
Thank you. Thank you, Dr. Thank you, everyone. Good evening. Well, we'll start with the fundamental question. Is it somebody's Wikipedia still says that this functional medicine is pseudoscience. What we'll discuss is pure science only. Okay. So I had the opportunity to speak at to a group of doctors at Tata Memorial Cancer Hospital. So I'm just sharing the same presentation that I have spoken there. Well, any chronic problem, there must be reason. It does not just come out of nowhere. Okay. And gut health could be one of the contributor if it is not keeping okay. Now, 70% of the immune system resides in the digestive tract. 90% of serotonin synthesized in the gut. Okay. And the microbes in the gut, they will regulate your inflammation, they will regulate your hormones, they will regulate your mitochondria, they will regulate your detox, and of course, the metabolic flexibility out of the mitochondria. So anything wrong with the gut function can lead to a multi-system chaos, can be brain, can be skin, can be immunity. So if we have to fix skin, we have to fix gut. If we have to fix brain, we have to fix gut. If we have to fix autoimmunity, we have to fix gut. Okay. So this is how important it is. And then whatever we will say, it is all established in the science. If somebody does not practice that is some now we should call that as a pseudoscience. If somebody says that this functional medicine which is highly established in science, if somebody calls it pseudoscience, means something wrong with their understanding. They need to upgrade themselves. Okay. Now first we will talk about the gut health itself and what are the major problems there. Then we will talk about how it is contributing to more systemic problems, common ones. Now, GERD, as simple as GERD, which is a reflux problem, people suffer for decades with the problem. People suffering for decades and they are on antacids and this problem is not going anywhere. Because high stomach acid is not even the problem. The stomach should be acidic. That is the nature of the body. Stomach should be acidic. But when the stomach acid is floating into the esophagus, where the stomach acid should not be there, it is where the problem is. Okay. Now, you keep reducing your stomach acid and you get into more complications over a period of time. But high stomach acid was never even a problem. But anybody with the reflux problem, they are treated with as high stomach acid is the problem and they are on the drugs for the decades. There's no coming out of the problem. It is only getting worse. Now, if that is the science, then something is missing there. All right. Now, it is well established that one of the reason for GERD is small intestinal bacterial overgrowth. Now, of course, along with the bacterial overgrowth, there could be fungal overgrowth, there could be parasitic overgrowth, all of that. But let's keep it to SIBO only. How SIBO will cause GERD? Now, your abdomen has a limited space, right? Let's say intestines has an infection. That infection is causing putrefaction of and fermentation of your food. Thereby, there's more production of the gas, can be hydrogen, can be methane, can be hydrogen sulfide or something else also. This will increase your intra-abdominal pressure. Now, from the bottom to upwards, there's a pressure. The intestines are bloated. From the bottom to the upward, there's a pressure that is causing the reflux of the content of the stomach into the esophagus. Is one of the primary reason for long-standing GERD. If you treat SIBO, GERD will get better. It's not about high stomach acid. It's about SIBO, which is the contributing factor to it. Now, second contributing factor is the motility. Let's say if the content of the stomach is not easily moving down, okay, there's established constipation in the person, long-standing constipation. Then also the motility loss can lead to reflux. And of course, there could be neuroimmune sensitization, there could be inadequate LES signaling. And one of the reasons, of course, is low stomach acid can cause poor sphincter closure. If sphincter is not closed, which is leading to reflux because stomach acid is low, contrary to what is told that is a high stomach acid, is actually low. And it is established in the physiology books. When you go to first year MBBS class, it's a Guyton and Hall physiology book will tell you that low stomach acid can cause a poor closure of the sphincter, thereby reflux can happen. Now imagine you are on antacid for decades and you don't come out of it because you are treating something which is not even there or which is itself is the problem, and you keep worsening the problem. That is a sign for you. Okay, GERD caused by SIBO leading to endless problems. Second most common problem is IBS. Again, people suffer for decades and decades with this problem. Sometimes there's constipation, sometimes there's chronic diarrhea, sometimes a mix of things. But a lot of time, people are told that this is something in your mind, something in your brain, which is causing constipation. There's no obvious problem. I've done endoscopy, I've done colonoscopy. I don't see any problem. There's nothing wrong. It's just you are imagining things. But real people suffer for decades with this problem. And how we are calling it something in the mind. Okay. Now, if we imagine the basics, by name itself, it is irritable bowel. As simple as something is irritating the bowels. What that can be irritate, what that could be irritating the bowels? First, it's the diet itself. If you're eating something which is not suiting your bowels, for example, milk, for example, sugars, for example, gluten, or any other food which you're sensitive to, that can irritate the bowels and may cause higher motility or low motility, and you can have a problem. Second most common part of the problem is infections in the gut. If there are infections in the gut, these infections will make toxins and these toxins will irritate the gut. Okay. Now, if somebody has hydrogen SIBO, hydrogen producing SIBO will cause a lot of diarrhea. There could be high histamine in the gut. And high histamine, you eat a little bit of banana, you eat a little bit of a sugar, you eat a little white rice, you have to rush to the bathroom after a meal. Because high histamine produced by this endotoxin is one problem. Okay. And sometimes there could be lack of certain species of the probiotics which could be producing serotonin, and serotonin is the thing which is also helping the motility part. Okay. Now, if somebody is suffering from IBS, we need to really pin down what is wrong. Is it food? Is it infection, or what kind of infection? What is the play or lack of certain healthy microbes which is causing the problem? Okay, so change in the microflora, severe infection, causing inflammation, causing stimulation to the nervous system, unnecessary contraction of the intestine muscle, eventually the symptoms, right? Abdominal pain, cramping, bloating, excess gas, all of that. And If you figure out what is it is triggered by, you work on that, you clear that, your base is also clear. People don't have to suffer for decades and decades. Okay. Now depends on the kind of infections. If hydrogen dominant infections are there, there'll be more gas and diarrhea. If there is methane dominant SIBO is there, methane producing infections are there, there can be more constipation and gas tract, less motility. Okay, and sometimes there could be hydrogen sulfide SIBO, which can be giving a gas which has rotten egg smell or highly toxic gas. Now, depends on the presentation, you can really figure out what could be happening, and accordingly, you can treat these things. As you treat them, the person will get better. Now, constipation remains one of the key problem people suffer. Again, multiple drivers to that. It's not an easy problem sometimes. Again, same problem, people can suffer for decades. And everybody saying eat fiber, hydration. Yes, low fiber, low hydration, sedentary lifestyle, chronic stress is one of the easy solving problems. But sometimes a lot of people eat enough fruits, enough fiber, enough salads, they don't get better. They have enough water, they don't get better. They exercise, they don't get better. What is beyond the basics? It can be low bile. Your liver is not making or your gallbladder not concentrating enough bile. That can cause digestive failure and consequently constipation. Your low enzymes, low stomach acid can cause constipation. If there's a methane SIBO, infections in the gut, in the small intestine, or fungal overgrowth can cause constipation. Low thyroid, not about TSH. If your T3 is low, that itself can cause you constipation. If your progesterone is low, that can cause you constipation. Cortisol dysregulation can cause you constipation. Of course, with the age, there could be enteric nervous system degeneration. There'll be more methane producers. There's low short chain fatty acids. All of that can also be neuropathy over a period of time. But sometimes basic answers given to us is not enough. Then we have to go beyond the basics and look for what really is the problem with the person, and slowly, gradually, we have to work and treat that problem. Okay. Now, human system is a connected system, right? Now, there are doctors who are only looking at the gut, only looking at the liver, only looking at the immune system, only looking at the brain. But if you really look at it, it's all connected. If something goes wrong in one part, that will affect the other part. That happens truly in the gut case. If gut is unwell, we are not able to throw out toxins out of the gut, or infections are growing, then the bad situation in the gut can lead to a situation called leaky gut. Now, ideally, nutrition should go into the blood. Toxins, uh, small particles from bacteria, virus, fungi, things like that should not get into the blood. But let's suppose unwanted things are floating into the blood because of the increased permeability of the gut. That can lead to a lot of systemic disorder. Okay, and this happens because gut mucosal barrier is broken. Again, this is established in science. This is nothing that I'm saying out of my own whims and fancies. It's they're established in the science. So, gut mucosal lining has multiple layers. In the gut is lumen, then outer mucous lining, inner mucous lining, then epithelial cells. For example, this whole cascade of things is broken. Then unwanted things from the gut can lead to. And what can cause that? Let's say physical stress can cause it. Infections, mycotoxins can cause it. Alcohol can cause it. Chronic stress can cause it. All of that. When you have that, you have leaky gut, you have toxins floating into your system. And then you eventually start developing a systemic problem, and can be called as autoimmune also, which can be rheumatoid arthritis, which can be just simple joint pains, or some people will have more sensitivities to certain foods which was not there earlier. And these people can have more sugar craving, carb craving. They can develop eczema, they can develop psoriasis, they can have hormonal imbalances, they can have fatigue, they can have arthralgia, and of course multiple problems. And some of them eventually they start with one problem, then another autoimmune, multiple autoimmune problems can also flare up. And most of that is starting in the imbalanced gut. So if we have to solve a rheumatoid arthritis, we have to start working at the gut. Else it's not going anywhere. If we have to solve rosacea, we have to solve eczema, we have to work on the gut. Of course, there could be other players also, which is sort of triggering that. We can always look at it, but this is the one of the key player where we have to put in effort. Okay, so how infections can lead to leaky gut? So basically, there's an overgrowth of the bacteria, virus, fungi, parasite that damages the tight junctions in the gut lining. Okay, and also the support to the gut lining, the whatever the endothelial cells are holding on to, it is broken down. Right now, eventually there could be a inflammation and immune activation happening. Right, and eventually there is a metabolite production of these infections lead to more permeability, more inflammation in the gut, and then eventually there's a reduction of the mucous lining, less mucus production and degradation of the pathogens that is leading to the exposure of the gut lining. So infections leading to various toxins and damage to the gut lining leading to a leaky gut. Okay, and where it can start? It can start with antibiotics, overuse of antibiotics. It can start with overuse of steroids. It can be stress. It can be poor diet. It can be infections. It can be bottle feeding in a young child. It can be old age. It can be radiation. It can be alcohol. Multiple things which can sort of cascade this thing into a big problem. A lot of people, they were never allergic to a food. Eventually, they've become more and more allergic as the problem is growing. Okay, that one of the reason behind that increasing allergies and sensitivities to the some of the foods is also dysbiosis of the gut and leaky gut. If we fix the dysbiosis, if we fix the leaky gut, there are good chances that we can fix some of these food allergies also. So just to bring your attention that how important is this digestive tract for us. Okay, now one of the reason of autoimmunity, one of the major contributor to autoimmunity is molecular mimicry. So a young child, 7 years old, there's no problem. Out of nowhere, we see sugars are shot up, and eventually we figure out the child has developed a type 1 diabetes. Now, there's some data is there suggesting that the milk protein to which probably immune system has been reacting has the similar mimicry to the pancreatic proteins. Now, antibody made against the milk protein start attacking the pancreatic cells. Similarly, in Hashimoto thyroiditis, is an antibody against your gluten molecule start attacking the thyroid proteins. So molecular mimicry can happen because of the food that are reacting to us, and it also can happen if some infections are causing intercellular infections. For example, some microbes are there within the cells that also can trigger the autoimmune molecular mimicry response leading to autoimmunity. So if we have to fix autoimmunity, we have to calm the immune system down, we have to remove what is causing it, we have to seal the leaky gut, we have to clean the infections. Okay, a lot of discussion is around, oh, why some doctors are asking you to reduce gluten when you don't have celiac disease. There's something called non-celiac gluten sensitivity. Okay, it is not necessary that you will develop celiac disease because of the gluten. You may not have a celiac disease, but you still may be reacting. Okay, so sometimes we have to go beyond the basics, right? So, all in all, anybody developing a gut problem or eventually developing autoimmune problem, some of the key problems that they would have is an overgrowth of the microbes. That can be bacteria, that can be virus, that can be fungi, parasite, eventually leading to a permeable gut, increased permeability. And there's a high possibility these people will also have low stomach acid or low digestive enzyme production, and they will start developing allergy, sensitivity, intolerance to certain foods. And eventually there could be high motility, low motility, depends on the presentation. Now, this is the starting of the problem, right? Then they will have different manifestations of different problems. Now, how the gut problems can lead to different systemic issues. Okay. Now, the chronic burden of the disease is increasing. Type 2 diabetes is increasing, fatty liver is increasing, cardiovascular disease is increasing, autoimmunity, neurodegeneration, cancers, all of us are increasing. And there is a high possibility that all of these people will have a poor digestive health. But unfortunately, nobody looks at the digestive system. It's too boring. If I am a cardiovascular surgeon, I am interested in the stenting. Whether something happens in the gut or not, I'm not least bothered. That is where it is today. If I'm a rheumatologist, I can give you drugs to modify the disease, but what is happening in the gut, nobody's looking at it, right? So, for example, if you look at diabetes, okay, now there could be multiple scenarios in diabetes. There could be insulin resistance, there could be poor pancreatic output. But let's talk about insulin resistance now. The machinery of your cell, which is the mitochondria, which has to consume your fuel, which is your sugar, into energy, is broken. The mitochondrial health is poor, leading to poor metabolism, leading to a metabolic disorder, leading to blood sugar going high. Okay. But you go to doctor first give you metformin works fantastic, which is actually working on the mitochondria, which is okay. But sometimes it is not working, then they will start giving you drugs which is producing more insulin. Okay, now problem is in the engine. It's not a lack of metformin, it is not lack of more insulin, it is actually high insulin, type 2 diabetes. But nobody's looking at the mitochondria, right? And one of the drivers of poor metabolic health, poor mitochondrial health is your gut problem. Let's say somebody has infections, that infection will produce more LPS, lipopolysaccharide, with the toxic waste of the microbe, and that will drive up insulin resistance. Infections in the gut, we call it dysbiosis, can lead to impaired GLP-1 signaling. Now, a lot of discussion, debate, and availability of Manzaros and all that. But nobody looking, why do we have a problem in the first place? And it could be starting in the gut. Of course, we can take a drug and all that. Temporarily, we may try to fix it. But why this problem is there in the first place? And that could be the gut problem. Now, a lot of people out of nowhere develop this fatty liver. Okay, we call it non-alcoholic fatty liver. It's okay, good, cool name, non-alcoholic fatty liver. Yes, it could be alcohol could be causing it. In this case, the person is not drinking alcohol. Then why did we get it? There's no answer into definition. Non-alcoholic is fine, but where is this problem coming from? Okay, now if we want to understand simply, a function of the liver is to detoxify whatever is getting into our system. Okay, let's say somebody's gut is bad, right? There could be more increased permeability, more portal endotoxemia, dysbiosis driven choline depletion. There's more toxins from the gut going to the liver, and liver has to work hard. Okay. Now, if liver has to work hard, there's not enough nutrition into the liver, it has to work overburden, it will start getting inflamed. And metabolic dysfunction in the liver lead to a non-alcoholic fatty liver. Okay, now there's something called auto brewery syndrome. We may not be drinking alcohol from outside, but the high possibility is our infections are turning our sugars or carbohydrates into alcohol. We don't drink from outside, we still could be making our own alcohol, which could be poisoning our liver. Similarly, alcohol, ethanol, methanol, formaldehyde, acetaldehyde, so many of these compounds could be made by the microbes in the gut. So if we have to fix somebody with a liver problem, we have to come back to the gut only. In the standard conventional way, we are put onto cholesterol lowering drugs. Cholesterol is hardly a problem there. It's something else that is happening, leading to more fat accumulation into the organ. Okay, because we look at the organ and it looks fatty, we say fat is the problem. Why would we have fat in the first place? It's a inflammation and microbiome driven toxicity. Now in the cardiology thing, somebody gets a chest pain, means a block. There can be a chest pain without a block also. Okay, and we call it myocardial infarction with non-obstructive coronary arteries. And what are we doing about it? Nothing. Somebody has chest pain, you do your angiogram, there's no block, nothing is done. It's all right. Let's wait for it. But why is it happening? Right? The cell, the myocyte is not getting enough energy because of the lack of nutrition into the cell, leading to low energy output, leading to angina. Okay. So what is that we have to do? We also have to look at the mitochondrial nutrition for that myocyte, and that can be CoQ10, carnitine, omega 3, along with the endothelial repair. And one of the, again, driver for this cardiovascular disease can come from the gut health. Now, there's a marker that we are measuring nowadays that is called TMAO. Okay. Now, if gut has more infections, TMAO will be high, and high TMAO will means eventually a cardiovascular disease. It's a very, very good marker for progressive problem that we can track even before the problem has happened. If TMAO has been high, you can expect the problem is coming. A chronic low-grade endotoxemia from the gut. Toxins will lead to systemic inflammation, and some of the systemic uh, markers will go up. Interleukin 6, TNF alpha. These are also one of the driver is a poor gut health. Now, gut is bad, leading to more toxins, leading to more TMAO, leading to more IL-6, TNF alpha, leading to a cardiovascular disease. And autoimmunity, of course, loss of all oral tolerance to certain foods. Okay, there could be imbalance of the two arms of the immune system that eventually can lead to Hashimoto's, IBD, IgA nephropathy, things like that. And most often this could be initiated in the gut. Okay, same with the neurodegeneration problems of the brain. Now, some of these neurotransmitters are made in the gut, used in the brain. If microbiome is bad, there's an issue. Okay, a lot of people with anxiety, they can have more histamine, and histamine could be produced in the gut. Okay, now there could be lack of the butyrate, which is short chain fatty acid. Now, lack of the healthy stuff can also lead to neuroinflammation. Okay, lot of time a person with Parkinsonism could have a long history of a poor gut health. Parkinsonism does not happen out of nowhere. If you look at them, they would have a poor gut health. Okay, Alzheimer's is also associated with dysbiosis and inflammation. So this is how this is connected. Somebody with the poor gut health can have a cardiac problem, can have a kidney problem, can have a brain problem, can have immune problem. These are all linked. So if we have to solve the end problem, we have to see where it is starting from and trying to fix on that. And of course, now a lot of the integrated practitioners are working on cancer by working on the gut. Okay, this is just for your information today, and now we can open up to the questions also, uh, so that we can take your specific questions as well.
I think we can start with questions in the chat.
Yeah.
So before we start with the Q&A, we'll just launch. So I request everyone to keep your questions ready so that we can make it quick. So Dr. Ashwini, you can start with taking the questions in the chat.
Yeah. So Rekha Rana says, I have Graves. Again, Rekha, Graves is an autoimmune problem. Now, when the flare up is heavy, you can, of course, go on to antithyroid drugs, which is all right. But at the end of the day, it's an immune system dysregulation leading to Graves. So if you have to do something about Graves, you have to stabilize the gut, immune system. If you have to stabilize the immune system, you have to look at what are the triggers of autoimmunity. Again, like I mentioned, it could be gut problems, could be food problems, could be heavy metals, could be lack of nutrition, and sometimes it could be a problem with the thymus gland. So if we fix these triggers to the immune system, most likely immune system will calm down, thyroid antibodies will sort of calm down, and you will have a stable thyroid output. May not be hyperthyroid. Okay. Now, sometimes there could be a straight away destruction to the thyroid gland. Sometimes there could be higher production of the hormone by this TSH receptor antibodies. So if we stabilize your immune system, most likely things will get better. Lalita says RA, like I mentioned, RA is again an immune system dysregulation leading to your joint problem. So if we stabilize the immune system, we can put a pause to the RA.
Um, I think we can skip some of the conditions that people had mentioned, and you can take the questions in the bottom in the new chats.
Okay. How do we know which bacteria, good or bad, do we? Okay. So first of all, we can do organic acid testing. We can do microbiome testing to know which ones are bad and which ones are missing. Yes, we can use antimicrobials, we can use probiotics, oral, we can use enema probiotics, depends on what is the requirement, and slowly, gradually. And prebiotics is the key thing that we can help using that we can reestablish the diversity of the microbiome. How do we know the root cause of the GERD and it can be cured? Well, like I said, GERD, one of the reason is your low stomach acid. Low stomach acid is a state where H. pylori can easily grow. Okay. And H. pylori can erode away your stomach lining. So if you improve your stomach lining, clean the H. pylori with herbals, and you improve your stomach acid, you're good to go. Okay. You don't have to unnecessarily keep suffering from it. Can gut be fully fixed if fixed? Well, see again, this is something we have to really understand. Okay. Just like a car, that even is very expensive car we buy, if you don't maintain it well, it can go wrong anytime. Okay. Can you keep a healthy body and a healthy digestion? Yes, it is possible, most likely, uh, provided we are willing to work on it. If we work on it, it will get better, and you have to maintain that. What does not suit you, what does not work for you, you have to stop it putting into your body. Okay. If fixed, can we fix eczema? Eczema is simplest thing. I mean, it's not most likely. Some people have eczema from 2-3 decades and they have a history of steroids. Then it becomes pretty hard to fix it. But if it's a recent 2-3 years of eczema, you have not done steroids, it's an easy fix. It's not a problem. Uh, what else? Moderate erosive gastritis, duodenitis. Yes, see again, there's an inflammation of the lining of the stomach and lining of the duodenum, plus there's an infection, plus there's a low stomach acid. Okay, so we have to fix the stomach lining, we have to improve the stomach acid, and we have to clean the infection. This can happen. If we do the right way, it is, of course, a possibility. Bloating and GI erosion. Well, infections can cause the erosion, infections can cause the bloating. So yes, it is. It can coexist. Well, I have taken all the questions, and now
We can open up Q&A. Does anyone have questions? You can raise your hand. Chetan has a question. Chetan, you can unmute yourself and ask.
Hello. Yeah.
yeah, Chetan.
Yeah. Actually, I've just recently done my blood test, and I found that high lipoprotein A is there, and homocysteine values are also high.
Ah,
So, and for that, doctor told me to test MTHFR test. That is something related to genetics.
yeah.
That was positive. For that, homocysteine is high. the doctor told. But don't know about the lipoprotein A. Why, it is also related to genetics.
No.
So
So, yes. So your homocysteine can go high when you have low B9, B6, B12, or high toxins, or especially lead in the body. Okay. Now, when you have a MTHFR problem, that means your methylation is a problem.
yeah,
Yes.
methylation problem.
That means if little toxin can create higher homocysteine. Okay. But that does not mean that we keep the homocysteine high if you have MTHFR issue. So we can give you methylated B vitamins or other methylation support so that body can have enough methylate donors to reduce your homocysteine.
Okay.
Okay, you have
And
genetic predisposition to it. We can work around it and fix it.
okay.
Okay. Now, your lipoprotein A is an inflammatory marker.
Okay.
If you have poor digestive health, that can cause inflammation and this marker can go up. If you have toxicity, like I said, lead, mercury, aluminum, that can make your LPA go high. Or if you have nutritional deficiency, that can also create that issue. So if that is high, we need to see what is it caused by. Not just because genetics. Yes, because of genetics, we may have a more predisposition to a problem. Fair point. But can we do something about it? Yes, certainly we can do a lot of things about it and then make sure that these markers keep in check.
Actually, the doctor told me there is not particular treatment for to lower the LPA.
Who is the doctor, sir?
That
Who's the doctor?
the doctor in Bombay, the cardiologist, Doctor Nilesh Gautam, he told me that you have to take statin.
Statin is a drug which reduces the production of LDL from the liver. Now
Yeah, yeah.
imagine, why would liver make LDL? Is our body, our liver, our immune is a crazy system just making something out of nowhere and we are too smart to stop the production? Okay. So when, sometimes we don't think beyond the basics. Okay. So can we reduce your the lipoproteins,
LPA.
LPA? Yes, we can reduce. And most likely, again, I'm saying if you have gut problems, the answer will be there.
Actually, I don't have any problems related to guts.
So toxicity could be a thing. We can check your heavy metals. We can check your metabolic function, and we can
Okay.
still see what is still causing it. Okay. Sometimes
Okay.
toxicity can cause the inflammation in the body, and NP can go up.
Okay. Okay. Thank you.
So before we move on to the next question, we have launched a poll. So if everyone can just answer the poll, that will be useful for the team to connect. All right. So there are two people in the chat who have said how to raise the hand. So Jude, if you are here, you can unmute and ask your question. Varsha also, if you're here, you can unmute and ask.
Hi, this is Seema here. I've had my hand up for a bit.
Yeah. Seema, go on, please.
Yeah, so I think I've already reached out to Anwar and I've said my reports. My concern is that a lot of this I have had to read up on Instagram, and in fact, even functional medicine is something that internet has made us more aware on.
Yes.
I'm curious to know how, and I have a kind of a working with data kind of a background. So I'm trying to understand that, yes, you'll do your analysis and we may even have improved. How do you ensure that that improvement is sustained? So first is, how do you establish that, quantifiable way? Is there a mechanism that establish that, yes, there has been improvement? It should not be just symptomatic, because symptomatic could be just temporary, right? How do
No, no.
you
So,
how do you
okay.
focus on
Now,
getting
now,
sustained
since
improvement?
since Seema, now, first of all, whatever we are saying and doing is established in the science. Okay. Now, it's not established in the practice. That is a sort of a disconnect. Second is, we never do symptomatic treatment. Okay. If somebody comes to me with rheumatoid arthritis, now symptomatic treatment for rheumatoid arthritis, first is a painkiller. Second is methotrexate, then probably a higher dose of immune suppressants. Okay. We never work on immune suppressants and all that. Once in a while, if required pain is we may say painkiller, but we want to regulate your immune system, which is causing the autoimmunity, which is causing the rheumatoid arthritis. Now,
Yeah, so
you
let me
will
give you a
feel better.
specific.
No. Let me
Sorry.
address. Now, one of the marker for your rheumatoid, for example, is anti-nuclear antibodies, ANA, right? As we work with you, your ANA will start dropping down towards normal. No drug can bring it down. You
So in
understand?
my case, like I have H. pylori, I've
Yeah.
taken 2 weeks treatment. How do I know
No.
that it is?
H. pylori is not your problem. Your problem can be gastritis. Your problem can be reflux.
Mm.
H. pylori is the guy who's blamed for the problem.
Mm.
Okay. Now, like I said, reflux can happen because you have infection, which is causing increased abdominal pressure. Thereby, reflux can happen. Reflux can happen when you have low stomach acid, and in the low stomach acid state, H. pylori can grow. Okay, or you can have gastritis over a period of time. Infections can erode up your stomach lining, then you can have that. Now, our job is to seal the gastritis, heal the gastritis, improve stomach acid, improve the function of the sphincters. Low magnesium, low stomach acid state can also cause the opening of the sphincter, which is not closing down to stop the reflux. H. pylori is not always a problem. A lot of Indians or around the world, people may have H. pylori. Even a healthy person with no symptoms of the upper GI can have a H. pylori infection.
Okay.
So that way we have to think the right way.
Hello, sir. Hello,
Yeah, Varsha.
I'm Varsha. So, sir, touchwood, I don't have any problems as of now, like be it hair or gut or any other thing. But then I'm actually I'm into research, so I really like the idea of functional medicine initially, and then initially, as in, like, I still like it, but then I had my doubts. That was what I was asking in the beginning.
Okay.
Sorry, I'm somebody who talks very straight. I'll ask questions, and it was not intended to
No problem, no
insult.
problem.
It
Don't
was
worry
not an
about it.
insult.
We are here
Maybe
to see.
that's why I was blocked, I think. I don't know. So
No,
I'm just
nobody's
asking.
blocking you. Are talking. No, why would we block
No,
you?
right now I'm talking, yes, but I'm unable to raise my hands because this is not the first Zoom meeting that I'm attending. So maybe I'm not
No
able to
worries.
raise my
No worries.
hands.
You please ask
Anyways,
your
let's
question.
not. Yeah. So my question is like, I've got to know about your program. I've Googled for people in Bangalore doing that because I'm from Bangalore. So I was, Google. I did Google and then I found out your institute and I was just reading it. So how is this? So if I take this blood work that you have suggested, I took the discovery call also, and afterwards I got this idea that if we take this blood work, so you would be recognizing the patterns in my body, and then maybe is that how you will you suggest? I'm just afraid if I'll have cancer. I don't know why. Maybe I'm overthinking. So if there is a way that can alert me, okay, you might have cancer in future, so if you just regulate your eating and all that, you will be.
See, what is important, Varsha, is more than the biology, the psychology has to be okay. See, we humans are both biology and the energy system. Okay, first of all, please don't overthink. This is important. Now, second, what are we trying to do? Let's say somebody has a problem. Why would the problem come? Because body is not able to regulate itself better. The state of homeostasis is not there. Even a cancer comes when immune system is not able to handle the problem. Okay.
Okay.
Now, I may not test you for cancer markers, but if your nutrition is low, if your toxicities are high, if you have infections, which can create a condition of weakened immune system. If immune system is weak, there's a possibility any problem can come. Okay. So we are just trying to, in your case, when you don't have a problem, we're just trying to put you on a right lifestyle, put you on a right diet. And if markers are suggesting some problem, that your liver is not okay, thyroid is not okay, we're just trying to bring a better homeostatic state to your body. So the chance of a problem coming to your body will reduce significantly.
I was searching for something like this, so yeah, like I understand. Thank you so much.
Abdul Wahid, yes.
Hi, doctor.
Yes.
Yeah, I'm one of your consulted patient actually. After the first question was related to the genetics, which you have clarified in the previous question. Um, just one thing I observed on the second one. One thing I observed in my one of my microbiome tests.
Yeah.
Like for example, you take multivitamins, you're consuming it every time together with other vitamins and things. My B1, B6, B12, B7, and all are all looking great. There's B3, which is not at all, within the range that it has to be, and it's far off.
Okay.
Usually, when we take these kind of combinations, is there any reason why the gut doesn't take it up properly? How do we can manage it?
So maybe Abdul, what possibilities there is the supplement. See, some of these things, let's say out of the B complex, whatever the B vitamins are there, some may be required more, some may be used less. Okay, probably the B complex that we use does not have enough B3.
Sorry, doctor. I'm using nutritional yeast for my B3. I mean, Bs, multivitamin Bs, nutritional yeast.
But are we sure that nutritional yeast will have all the required components there?
I mean, in the label, yes, I can see the.
No, dosing also important. Okay, so let's say we do a good dosing B vitamin to our people that we work with, and after 3 months we find out that something has improved, something has not. Then we add the specific B vitamin along with the B complex to ensure that enough goes into the body. That is one. Now, ideally, everything should come from the food, and our digestive system should be able to break it down and extract out of it. Ideally, that should happen. But unfortunately, today, if you look at it, the food chain itself has been corrupted, and our microbiome is not healthy enough to sort of do the job. Probably then one of the reason our markers may not look as good as we want.
Got you. Thank you. Yeah, we'll still need to consult for sure.
All right. Yeah.
Hello,
Sahiba?
sir.
Just a minute. We'll take one question from the chat so that we can finish that. So there's a question, Dr. Ashwani, by Arun Kumar. His
Yeah.
son is 3 years old and is suffering from constipation, and he has autism symptoms as well, along with speech delay. So his question is, does constipation is the reason for the autism symptoms and the speech delay, and can that be fixed?
Well, let's say again, autism is not a simple problem, it's a multiple complex disorder. Let's say child has aggressive behavior, child has anxiety problem. Okay. Now, constipation lead to less toxin mobilization out of the gut. That will lead to higher histamine trigger. That will lead to hyperactivity. That may lead to aggression. That may lead to, let's say, more stimming. Okay. So yes, in this way, we can say constipation could be contributing to some of these symptoms. Now, when we say speech delay, we are saying essentially that brain health is compromised. Okay. Now, brain health, why it be compromised? Either the growth is not happening or something has happened which has led to inflammation of the brain, which has led to regression, which has led to a problem. Okay. Now, one of the possibility of poor growth or poor brain development is a poor nutrition. And when constipation is there, digestion is poor, low nutrition can happen, that can impact the growth of the brain. Or toxins are there because constipation is there, which is causing inflammation, which is impacting the brain health, which is causing regression, thereby speech delay. So yes, there are ways directly, indirectly we can connect to constipation. But constipation may not be the only problem. There could be other issues also. But yes, it can be one of the things which could not be okay.
So, doctor, this is Arut speaking. So, how can we fix it? Like, what are the medicines or
So, well, first of all, we work on a diet and lifestyle, and we test the child for nutrition, infections, and toxins. This is the first level of play that we do. If infections are there, we want to clean. If toxins are there, we want to clean. If immune is dysregulated, we want to fix it. If liver is not okay, we want to fix it, all of that. And most likely child is 3 years, these basic things should kickstart a lot of growth. Okay. Sometimes this may not be enough, then we have to go into regenerative medicine. So layer by layer, if required, we can get there also.
Hello, sir.
Ah,
Sir, I had a word with you a few days back.
okay.
Um, I was the one who was asking about H. pylori and gastritis.
Okay. Okay.
I wanted to know one thing that you replied to somebody about this same very thing, that your problem is not H. pylori, it is the gastritis and all.
Hmm.
But sir, since I have also completed the antibiotics course and I'm not feeling any symptomatic relief, so what your functional medicine can help in this case? Because I have explicitly asked my doctor to suggest me some supplements, but he explicitly said no, we do not need supplements right now, and they are just prescribing the antacids and PPIs, which you only mentioned that these medicines will not work in this case because you are already having low stomach acid.
Well, if let's think about in a logical way. If any infection is persisting in our body, this means the immune system is compromised. Something
Yeah,
should be done. And one of the thing immune can be compromised as simple as low nutrition. If somebody
yeah,
says you don't need any support to the nutritional support to your immune system, that means something is missing there in terms of understanding. Hmm?
so can we
Uh,
take both simultaneously, like
yeah,
with
yeah, yeah.
allopathic
What is the
medicines going
problem?
on?
Yeah, yeah, yeah. No problem. Second is now there is a inflammation and gastritis erosions into the stomach. Okay. One way I kill the infection and let the body do what is best it can do. Second is I clean the infection and I give you a supplement which is called carnosine, which is a peptide which has the ability to heal the tissue. Will you recover faster with it or not?
Yes, definitely.
Right? So somebody says you don't need. Now, when you clean microbes through an antibiotic, you kill the bad ones and you kill the good ones also. There's a tendency you grow unwanted will overgrow, especially fungi and all that. Do you need a probiotic with that to balance the side effects of the antibiotic?
Yes, definitely.
Okay. Now, when you heal your stomach lining, when balance is there, now you have to maintain your digestive system that needs enough stomach acid. If we short term give you bitter herbs, short term give you betaine HCl to have enough stomach acid to digest your food, what is wrong with that?
Yeah.
Okay.
So, but I have like tried multiple doctors. This is the third one I'm going to, and all of them had the same thing regarding this supplements. So either they do not support this supplements or what. I am like not sure.
No,
And
no. So
should I take
it's
on
like
my own?
no, no. Please understand. This is something very important for all of us to understand. Nothing wrong with the doctor. Doctor is doing what they know best. Problem is sometimes if they don't know other side, they will say it is bad. They don't know about it, but they will say it is bad. They should be just little open and say, I know this much, I can do this much for you. I don't know it is good or bad. If at least they say, I don't know, we can take a choice. But unfortunately, out of the ego, when they don't know about the other side, they say it is bad or you don't need it. That unnecessarily just limiting the options of healing. I'm also trained in allopathy. Whenever I need to use allopathy, what is my problem? As long as it helps my person I'm working with. We should not be against any other science. Whatever the science is there, we want to use it to help the person. This is good, this is
Yes.
bad. This is where the whole conflict starts.
Yeah.
Okay. Sahiba Malik, you can unmute yourself, please.
Hello.
Yes, ma'am.
Hi, sir. Sir, I'm Shivai's mother, Shivai's Malik mother.
Yeah, Sahiba. How are you?
सर आई एम गुड
हाँ
सर अब कंडीशन है 1 साल हो गया एफएमसी को छोड़े हुए
हाँ जी हाँ जी
सर दुबई गई थी
हाँ हाँ।
डॉक्टर काइल डेगल पे।
ओके।
उन्होंने शिवाय का स्कैन किया, न्यूरोजूमर टेस्ट।
हाँ हाँ
उन्होंने बताया राइट ब्रेन डेफिसिट है,
हाँ।
डोपामिन रिसेप्टर्स में फ्लक्चुएशन है, बिकॉज ऑफ दैट स्टॉप बटन उसका सही से वर्क नहीं कर रहा।
ठीक है।
ऐसे ऐसे करके उन्होंने बताया।
हाँ।
देन उन्होंने मुझे अपने फंक्शनल मेडिसिन डॉक्टर के साथ कनेक्ट कर दिया
हम्म
कि लाइक गट विल ऑल्सो वर्क। वही अपनी बात की, ब्रेन भी काम सही से करना चाहिए और गट भी करना चाहिए,
हम्म।
तभी कोई रिजल्ट निकलेगा।
हाँ हाँ।
अब जब मैं वहां एक हफ्ता इंटेंसिव लेके आई तो मुझे शिवाय में कुछ इम्प्रूवमेंट लगे।
ओके।
जैसे कि शिवाय ने ऊंचा चढ़ना बंद कर दिया, ऊपर
हम्म।
दरवाजों के ऊपर बैठ जाता था
हम्म।
वो सब कम कर दिया। मम्मा आया, पापा आया, दादा भी आया, वर्ड।
हम्म।
ठीक है। आई वाज लाइक, फिर जब मैंने उनका लेजर यूज करना शुरू करा और जब मैंने फंक्शनल मेडिसिन डॉक्टर के साथ उसके ओट्स टेस्ट कराया, ओट टेस्ट कराया उन्होंने उसका,
हाँ।
उसमें मुझे तो कुछ।
साहिबा आपका आवाज बंद हो गया।
हेलो, कैन यू हियर
हाँ
मी
हाँ।
सर?
यस यस
हाँ।
साहिबा।
तो उन्होंने मेरे को ज्यादा सप्लीमेंट्स तो नहीं दिए, 4-5 सप्लीमेंट्स दिए, जिसमें यही, और उसमें पेप्टाइड्स वो जरूर लगाते थे, जैसे आप रिजेनरेटिव मेडिसिन की
हाँ
बात कर रहे हैं।
हाँ हाँ हाँ।
उन्होंने वीआईपी स्प्रे, केपीवी, बीपीसी 157, ये
हम्म।
सब लगाया, उन्होंने बेनाजीन ये सब लगाया।
यस यस।
मतलब शिवाय की प्रोग्रेस ना मुझे वो नहीं दिख रही जो मैं एक्सपेक्ट कर रही थी। वही वाली बात है, मैं कहीं ना कहीं वहीं स्टक हूँ। अब मुझे ऐसा लगता है कोई भी न्यूट्रिशनल सप्लीमेंट नहीं। अब दे आर सेइंग टू गिव नॉन वेज टू शिवाय, क्योंकि उसको प्रोटीन की जरूरत है, प्रोटीन से डोपामिन रिसेप्टर 2 बनेगा, जिसकी वजह से वो वही सब उसका बिहेवियर वो दोबारा से अब चढ़ने लग गया ऊपर। एंड देन उसको विजुअल सा भी स्टिमिंग आने लग गया जो कभी था ही नहीं। और अब मम्मा पापा भी उसने फिर से बोलना शुरू कर दिया, बंद कर दिया। मेरे को समझ नहीं आ रहा सर, अभी भी मैं स्टक हूँ, कुछ ना कुछ डेफिशिएंसी है जो हम पकड़ नहीं पा रहे। उस बस 6 इयर्स का हो गया अब शुरू।
हम्म।
अच्छा, आप, मैं चाहती हूँ एक आपका ओपिनियन, आप उसकी रिपोर्ट्स देखो, मुझे कुछ बताओ, या हम आगे कोई टेस्ट करें, वहीं पे जाएं, यहीं पे स्टक करें।
नहीं
सर
देखिए।
पैसा तो लगा रही हूँ
हाँ
लेकिन बच्चा
आई
नहीं आ रहा
नो
वापस।
आई नो साहिबा आई नो आप बहुत
और
कोशिश
सर
कर रहे हैं।
आपके वहाँ वो स्टेम सेल कराया था,
हाँ
जब आपके साथ वन टाइम ही कराया था,
हाँ
बच्चे का बिहेवियर अच्छा नहीं था
हाँ।
उस टाइम पर, तो मैं डर गई। अब मैंने ऐसी उनसे बात करी कि शिवाय में वो प्रोग्रेस नहीं हो रही है, तो दे आर सेइंग दैट ही नीड एम्प्टी इंजेक्शन, एम्प्टी थेरेपी।
वो
अब
क्या होता है?
एम्प्टी, वो कह रहे हैं कुछ हैवी मेटल्स के लिए इंजेक्शंस लगाते हैं उसमें। अब मुझे लग रहा है डर। मैं इतना तो, मुझे तो समझ नहीं आ रही सर
नहीं
क्या
नहीं।
करें।
हेवी मेटल्स के किलेशन नहीं करते हैं और कौन से एम्प्टी
पता
एम्प्टी।
नहीं, अब मैंने उनसे बात नहीं करी ना उसके बाद, अब वो कह
हाँ
रहे हैं अपॉइंटमेंट लेने के लिए, तो मैं स्टक हो रही हूँ बीच में बहुत ज्यादा कि अब क्या करूँ।
ठीक है। आप क्या कर लिए आप ना हमको भेज दीजिए कि आ,
सारी रिपोर्ट्स भेज दूँ आपको?
हाँ भेज दीजिए ना।
4 महीने पहले
कोलिन
की
है
है
वो।
सर।
कोलिन एम्प्टी वी कैन गिव कोलिन ओरली
कह रहे
ऑल्सो।
10 डेज, 10 डेज इंजेक्शन होते हैं, जो हैवी मेटल्स के लिए शायद
नहीं
कुछ।
क्या होता है कि वो सेल मेम्ब्रेन्स को अच्छा कर देते हैं जब भी हम कोलिन को आईवी फॉर्म में देंगे रिलेटिवली इट इज फास्टर। बट
ओके।
ऐसा नहीं है कि वो करने से हैवी मेटल निकल जाएगा। यस दे आर सेइंग कि वो सेल मेम्ब्रेन अच्छा हो जाता है उसका परमिबिलिटी अच्छा हो जाता है सेल से निकल जाता है हैवी मेटल।
ओके।
बट वही है कि इंटेंसिटी का फर्क हो सकता है उनके पास कुछ और टूल्स हो सकते हैं जो हम नहीं यूज करते हैं
नहीं
इन
नहीं,
द।
टूल्स तो सर बहुत थे उनके पास।
हाँ
टूल्स बहुत थे, गट हीलिंग के लिए, गट लाइनिंग को हील करने के लिए बहुत अच्छी एक मशीन थी,
हाँ
सॉफ्टवेव करके, वो भी उन्होंने उस पर यूज करी है
हाँ
बेटे पे
हाँ।
मेरे।
हम्म।
और उन्होंने न्यूरोजूमर, मतलब टेस्ट के अकॉर्डिंग सब कुछ उनका भी लैब बेस्ड है, जो दिख रहा है उसके स्कैनिंग करके ही वो करते हैं। क्यूईजी स्कैन किया इसके ब्रेन का, गट में भी जीआई ट्रैक वो जो टेस्ट होता है वो कराया, यूरिन से भी कराया, ओट टेस्ट कराया,
ठीक है। आप क्या करिए।
माइक्रोटॉक्सिन कराया।
हाँ हाँ। तो वो तो देखिए वो तो हम भी कर ही सकते हैं लेकिन हमको पता है देखो जैसे माइकोटॉक्सिन है हमको
हम्म।
पता है फंगल इन्फेक्शन है माइकोटॉक्सिन होगा ही, मैं उसका
जी
50,000 रुपये
जी।
क्यों लगाऊंगा आपका।
अरे बहुत लगा दिए सर।
नहीं नहीं। अब मेरा बात समझो ना कि कुछ
हाँ
चीजें मेरे
हाँ
को
हाँ,
पता है कि
ये
उसमें
पता
से क्या
होगा
निकलेगा।
जरूर।
तो मेरे
हाँ
को क्यों
होगा
करना
सर।
है। अब वो
जी।
ऑटो एंटीबॉडी ब्रेन का टेस्ट कर दिया मेरे को पता है वो ऑलरेडी है। मैं क्यों टेस्ट
हाँ
कराऊंगा आपका।
अब एक उन्होंने वो पैंस और पैंडास का हिसाब
तो
डाल
ऑलरेडी
दिया।
हमको पता, सी दैट्स द थिंग, नो, इफ यू रिमेम्बर हमने पहले भी बात किया था कि definitely there could be something that we don't know, but lot of times these Americans are very good at marketing things.
हाँ सर है तो।
Hmm? There could be something which we are missing. मैं जो ऑनलाइन
सर
में जितना
उन्होंने ना शिवाय के केस में एक्चुअली डॉक्टर जेन्युइन थे बहुत ज्यादा।
हाँ
जैसे आप बहुत आराम से वैसे पूरा डिस्क्राइब किया उन्होंने, अगर पैसा लिया तो मेरे बच्चे के बारे में उन्होंने मुझे
ठीक
समझा दिया।
ठीक है ठीक
लेकिन
है
दवाइयां वैसे काम नहीं कर रही थी, मतलब मैं कहूँ तो।
ठीक
ठीक
है।
है ना। तो उन्होंने ना मेरे से ना वीडियो बनवाई, कह रहे
हाँ
मेरी वीडियो बनाओ और आप इसको रखो अपने पास, लाइक
हाँ
मेरी वीडियो बनाओ शिवाय के केस में। मैंने कहा मुझे सिंपल टर्म्स में बता दो मेरे बच्चे को
हाँ
दिक्कत क्या है
हाँ
और
हाँ
हम ठीक कैसे कर सकते हैं इस
हाँ
बच्चे
हाँ
को।
हाँ।
तो उन्होंने मेरे से वीडियो भी बनवाई, अगर आप वो कहोगे तो मैं वो भी भेज दूंगी
आप
आपको
उसको
कि
समरी
उन्होंने
आप उसको समरी दे दो ना हमको, कोई प्रॉब्लम नहीं है।
उन्होंने यही बोला कि डोपामिन रिसेप्टर 1 और 2 ब्रेन में फ्लक्चुएटिंग है, जो इमोशनल रेगुलेशंस को अगर हम इफेक्ट करते हैं, जिसकी वजह से बच्चा स्टिम करता है और जैसे जंप करता है एक जगह प्लेस पे, और ऐसे ऐसे करके उन्होंने बताया। पूरी वीडियो तो मैं
नहीं ठीक है, चलिए आप
लॉजिक्स।
एक आप उनका जो भी नोट्स है, उनका जो टेस्ट का है, उन्होंने क्या क्या इंटरवेंशंस किया हमको भेज दो। लेट मी लुक एट इट, नो वरीज, विल वॉट
सर
एवर।
आप देखोगे, सर आप देखोगे, प्लीज सर, मैं बहुत ज्यादा परेशान हो गई।
नहीं आप, आई डू इट साहिबा, ओके।
ओके
आप प्लीज,
ओके ओके सर, चाहे अगर पर्सनल टॉक भी करनी पड़ी तो आई एम रेडी फॉर दैट,
नहीं
लाइक
चलिए
अगर आप मैं
ऐसा,
मतलब सर।
आप डेटा भेज दो, लेट मी हैव अ
ठीक
लुक
है।
एट इट एंड
ओके।
क्या हुआ है, आगे क्या करना है, लेट मी चॉक इट आउट एंड देन विल टॉक।
मतलब ऐसा हो रहा है, वर्ड्स आए, मम्मा आया, पापा आया, दादा आया, फिर चला जाता है। बच्चे की रिकॉग्निशन आई, DFHL, फिर चली जाती है। ऐसा क्या है, कौन सी डेफिशिएंसी हो रही है जो बार बार उसको
नहीं 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 नहीं, इफ यू
न्यूरो।
रिमेम्बर, देखिए जब तक इट्स लाइक यू बिल्डिंग अ हाउस इन रेन, है ना।
हम्म।
अगर पॉजिटिव को हमने हटाया नहीं, जैसे
हम्म
मान लो हमने ऑल द रीजेनेटिव मेडिसिन कर लिया,
हम्म
लेकिन जो प्रॉब्लम क्रिएटर अभी पड़ा है आपने रीबिल्ड
हम्म।
किया, उसने फिर से डैमेज कर दिया।
वही चक्कर हो रहा है सर।
अगर हैवी मेटल निकाला नहीं, ठीक है, हमने कोलिन दिया, हमने पेप्टाइड दिया, हमने थोड़ा
हम्म।
रिपेयर किया, थोड़ा चीजें आई, वो फिर से डैमेज हो गई, है ना।
हाँ
तो
जी।
एनीवे कोई बात नहीं, देखिए हम जो भी हम जेन्युइनली हम जितना समझ पा रहे हैं उतना हम, वी वांट टू हेल्प द चाइल्ड, अपना
ओके।
बच्चा है शिवाय। तो आप डिटेल
हाँ।
में भेज दो मेरे को, लेट मी हैव अ लुक, क्या क्या किया जो हम रिपीट करना चाहेंगे, क्या क्या किया जो नहीं होना चाहिए, क्या क्या नया होना चाहिए। लेट मी हैव अ थॉट ऑन एंड,
क्योंकि
सिंपल तो नहीं है,
हिटिंग
मैं
हिटिंग
कोशिश करता हूँ।
एग्रेशन भी बहुत आ रहा है, हिटिंग और एग्रेशन भी बहुत आ रहा
हम्म,
है, जिसकी वजह से स्कूल भी बंद कर रखा है। सर फिर तो मैं दोबारा वहीं जा रही हूँ, थेरेपी सेंटर्स के धक्के खाने शुरू कर दी। फिर क्या फायदा हुआ, 2 साल का था जब मैंने स्टार्ट किया था कि भाई अंदर से खत्म करना है, अंदर से खत्म करना है, क्या रूट कॉज है।
आई नो, डोंट वरी सर, आप भेज दो मेरे को।
नहीं तो सर रेस्पेरिडोन दे के बिठा देती, तब भी लेके आई थी सर।
नो आई नो।
मैं भेजती हूँ सर, सारी की सारी डाटा भेजती हूँ इधर ग्रुप में अपना, उसमें पर्सनल मैसेज में, एंड देन
ठीक है
आप प्लीज
सर,
देखना। ओके। थैंक यू सर।
टेक केयर।
Jude, please go ahead with your question.
Yeah. Hi, doctor. So, actually, you answered my question, but then you gave me a little bit of a shock as well.
ओके।
So this is the question about the eczema reversal that you just answered.
ओके।
So some context, doctor. So I know you don't do symptomatic treatment. You mentioned on the call. So they mentioned that it is eczema. So they've given me this prednisone as a uh,
स्टेरॉइड।
and also if I don't take citizine, it flares up, becomes very itchy and all of that, right? So if I take citizine, it kind of shuts off.
हाँ,
But in your reply, you said if you do that, then there's no chance of reversal, or it become
no
like
no
it's
no no no, let's say, how old are you, Jude?
35,
35. How long you have this problem?
maybe like 2, 3 years.
2 3 years. No, how long you have been using the steroid?
So I actually have now kind of stopped. I only take citizine. The reason
It
being,
doesn't
as
matter.
long as I take it, then it works, then it comes back,
So
right?
you
I
have,
don't want
how long you have done the steroids, Jude?
maybe like a few months, doctor. Like,
No worries, we can fix it. Okay, now I'm just giving you an example. We have a case where person is now 65 years old. he has been using steroid oral medication from last almost 40 years. Now, we in last 9 months, we are able to stabilize to 50% and we are able to reduce the steroid dose to half.
Okay.
In 9 months. Now, in your case, if it is only few months of you have done it, most likely it's 3-6 months, your eczema should be clean.
Okay. Okay. Awesome. Thank you. Doctor, quick follow-up. If I don't, I hope I'm not disturbing you. So, can I continue? So, I'm enrolling with your treatment. I'm just waiting for the tests and everything to get done. Can I continue that, or should I stop that when I work with your program?
No, you continue. See, symptomatic relief is important, but at the same time, we want to clean it outside from inside so that you don't need it. But we don't want you to, antihistamines are still all right, but steroid minimal use if at all you need it. But as we clean it, you would not need it eventually.
Okay. Thank you, doctor.
Okay. All righty. Well, then I think if we have addressed all the questions, we can wrap it up. So we're planning to have these sessions, let's say once in a month, so that at least, which whether you work with us, you don't work with us, at least we can share some information. And ultimately it's about, we all has to heal our own self. We can only come in and help and put a plan and direction, all of that. But mindset is important for healing. If somebody tells you this is the problem you cannot fix for life, then how do we even come out of it? Or somebody says this is a problem and this is for genetics and nothing can be done, then our mindset start believing that it is a non-workable problem. So with that, we want to just, give you more understanding of the disease and the solution, and then up to you what you want to do for you as health. Alrighty. Good evening, everyone. Everyone, take care.